I want to bring in my guest now, who's Dr. Sandile Mhlongo, to help, I guess, calm the situation down, Doc. And how do we do that? Give people information, tell the truth, get the facts out. Science needs to lead because this is a medical emergency. Doc, thank you very much indeed for sticking around and helping us navigate through this. What's the word in scientific circles, in medical circles? Are we likely to completely eradicate the virus, or is this pandemic likely to come in waves?
Blaine, thank you very much. It's a very challenging question that we don't know much about the virus. So we talk in terms of immunity around herd immunity, or that we typically see with viruses over time, that actually people develop immunity and therefore it becomes another typical seasonal infection that actually, like the flu viruses that we get annually. But we do know as well that actually viruses have a tendency to mutate, and therefore they change themselves a little bit, and therefore if you have been exposed before, it's possible that you can get reinfected with a mutated virus, which is a slightly different one that you've been previously exposed to. So we don't know enough yet. What we can obviously expect is that if it becomes like any of the other previous epidemics, is that it is likely that actually people should get herd immunity over time, and therefore it becomes one of those seasonal infections, nothing different to any other flu.
So what's the time frame in that? So you're saying there's a possibility that this disease is likely to become endemic, sort of the common cold, and if so, we are likely to develop this immunity to the condition. How long does it need to be around for this to happen?
Well, firstly, it means we all need to have been exposed to some extent. Therefore, everybody then will have developed immunity, and even if there is a mutation, be it a slight shift or a slight drift, then you actually have some memory in your immune system that actually you can launch quickly and therefore reduce the extent of the illness. We won't know this up until probably a few years from now, if that does become true of the COVID virus. What we certainly know right now is that none of us have immunity to it. So therefore, that's why you are seeing actually large outbreaks and large and frequent spread in small communities. So that is just the nature of the fact that none of us have ever been exposed to it. It is a new virus and is much more contagious than most of the other viruses that we've seen before. Hence, you're seeing the rapid nature of the spread.
What about treatment for this, Doc? What's currently on the market, on the shelves, in order to treat COVID-19? We hear, the word chloroquine. The U.S. President Donald Trump has been using this name quite often. It's getting people's hopes up. But with regards to a vaccine, the experts tell us that we are in a trial phase, and that is likely to take at least 12 months. Talk to us about this anti-malaria drugs that people are talking about.
So, yes, I have seen in the news a lot of talk around chloroquine. It is being pushed specifically, as you said, by the U.S. president as a potential treatment. There is no data that suggests that actually chloroquine does work. For us as a country that actually has malaria in the large northern eastern parts of the country, a very important drug in the armamentarium of managing malaria. So the concern that perhaps that health regulators and other experts would have in our country, that this rush to using a drug improving and is not known that actually does cause benefits, that we will probably see shortage, and therefore we create a new problem of actually malaria that is not well managed. It's an essential drug in South Africa, and for I would say until there is more data, we should be guided by what has been published. And in fact, actually, more important here is not treatment; it's rather prevention. So the typical things that we're talking about is what people should be doing, prevent rather than aim for when you have the illness, what to treat. Yeah. And on the last comment around the vaccine, absolutely, it's not going to happen anytime soon. We know the US FDA and other research centers have actually commented that it's probably 12 to 18 months away before we see a vaccine that is applicable for this virus. So in today's world, what doctors do for those that are diagnosed and are ill, it's largely supportive care, and that is the only thing that we have. Right. In China, they tried a few antivirals. We don't know if those worked, but it's just a trial and error for now. But what works is really care, ventilatory support for those that are severely ill and being admitted in high acuity ICUs where there's good support from a ventilation point of view and fluid management and that kind of thing.
Doc, we're running out of time. We've got to go, but I just need to squeeze in this one last question before I leave you. With regards to the transmission of this disease, the COVID-19, we know it's transmitted via respiratory droplets, so you have to sneeze or cough for it to get to the next person. But what about it being transmitted through mosquito bites, for instance, or even flies? What can you tell us with regards to that?
Absolutely not true. The WHO, in fact, as early as this week, published a note to that. There is no data that supports that actually it is transmitted through mosquito bites, and as far as we understand its nature is that it's transmitted via respiratory droplets only. That's what we know today. Yep. And obviously contact from surfaces where it has been inoculated to the mouth. There is no data otherwise that supports any other.
So we need all the help we can get in trying to stay safe and also bring, the facts to the nation about how do we, navigate through all this misinformation that we have. We really appreciate your time. Thank you very much indeed. That was Dr. Sandile Mhlongo. Dr. Mhlongo is the Managing Director from Akiso Clinics at the Netcare Group. Thank you very much indeed, sir.